With the cost of contraception rising, more people are being diagnosed with STDs than ever before. 48% of people under the age of 25 in Manchester and Salford have been diagnosed with an STI. Getting checked out for a sexually transmitted disease takes less than half an hour. You don't need to book in and it's completely anonymous. So I'm wondering why more young people don't get checked out and learn how to be safer with sex. Anthea Morris, founder of Better to Know, told me that preventing STIs completely is unlikely and that young people need to be safer with sex.
So there's no such thing as safe sex. All you can do is have safer sex. The only way to avoid having an STI is not to have sex at all. And as that's impractical for a large number of people, there are a number of things that you can do to avoid to reduce your risk of catching an STI.
My advice, if that you are worried about your sexual health, you don't want to go to your doctor about it, you're worried that your parents might find out, if you go and see the same doctor as your parents, is that you can go and have your test done privately. It's confidential, it's anonymous, you don't have to give your real name, so there's no way it can link back to your records. Better to Know offers that service in Salford and in Manchester and at 300 clinics across the UK. We set the business up because we felt that there was a need in the market for people who wanted a different type of sexual health testing. Perhaps the NHS services weren't meeting their requirements, and so we provided a different service, which was perhaps the service that we would want if we needed a sexual health test.
This person wanted to remain anonymous, so we've protected their identity.
When I was 15, I had unprotected sex for the first time and got chlamydia, and only found out that I had it when I went to get the pill, like the contraceptive pill. I thought everyone would just judge me or that my parents would find out, because I wasn't taught about stuff like that in school, so I didn't really know where to go or who I should tell. I think there should be a lot more information available, especially for young people, because that would have made it a lot easier for me, and I don't think I'd have felt so ashamed of it.
In Salford, syphilis rates are 4 times the national average, with gonorrhea rates also sitting at 2 times the national average. HIVs being diagnosed later in life, however, still sits at 10% higher than the rest of the UK. However, if you are from Salford, you're 2/3 less likely to contract chlamydia. James Holt, Salford Now.